achieveradio.com. Follow us on Twitter at twitter.com/achieveradio.
Here we go now. Come to the Carolyn. Here we go now. Here we go now. The wellness scene with Dr. D. Here we go now. Here we go now. Come to the Carolyn. The wellness scene with Dr. D.
Welcome, everyone, live with Dr. Carolyn Dean here on achieveradio.com this Monday, December 17, 2018, the last Monday of the year that we're going to be doing a live recorded show. And we're so happy to be with you, ladies and gentlemen, this evening in particular, to review this incredible year of health recovery for so many people, and to look forward to what the doctor of the future says about what our future holds. With us this evening, my name, of course, Ginny Sanders, also known as Ginny Almighty, is Dr. Carolyn Dean, the most prolific, profound, and powerful inspirer, innovator, and sayer of so many wonderful things about our bodies, the perfection they're in, and how they will function if you give them those essential building blocks, one of which being magnesium. And it's so sweet because I heard somebody said to me the other day, well, you know, a lot of times when I listen to Carolyn, it just seems like what she says over and over again is take Remag. And we're like, yes, the message is getting through. Take Remag, ladies and gentlemen, as the beginning, the first step to any health recovery program or any health protection program or any kind of health maintenance program or any preventative program, because magnesium is so essential to body function. And, of course, the person who's figured this out and is declaring this in such a broad and powerful way is Dr. Dean. Before I bring her on the line, I'm just going to remind you, she does not give medical advice on a radio show. That would be a big fat no-no. Instead, what she will do is she'll talk to you about the structure and the function of the body, why magnesium and minerals and a healthy lifestyle and diet and exercise and so many other things are so critical, and she'll talk to you about what she would do if it were you, her, in your position, which she has done many times, being the alchemist that she is, and the wild and crazy woman out there on the leading edge of creation who's bringing so many incredible health innovations and so much great health information around the world, really, honestly, to everyone who's willing to be here and to listen. So we want to welcome her again this evening. Welcome, Dr. Carolyn Dean.
Thank you, Ginny. So we're not doing Christmas Eve and New Year's Eve, eh? We're giving up on our folks. This is it? This is the end of the year?
Well, actually, our producer, Bill, deserves a little bit of a holiday. He's not going to be doing Christmas Eve, and we could do New Year's Eve, but traditionally we don't. So this is it for the year, but we'll be back in 2019, loud and strong. And but yeah, this is it for the time being.
So this is it. We've got to get this done. We've got to hammer into people's heads one last time that, yes, Remag is the answer. I know years ago I only talked about magnesium, and then when we had the product ourselves, and even just maybe 2 years ago, Bob started saying, no, you can't say magnesium, you have to say Remag. And why and what we're saying there is that we have noticed over and over again people who've tried other magnesiums, they don't get the results. So we'll constantly get letters and phone calls from potential customers who'll say, well, you know, I've read your book and I've tried magnesium and it's not working. And we know now to say right off the bat, well, what kind of magnesium are you taking? And unless they're taking Remag, it's potentially not going to do what we indicate it will do. And we do skate a fine line here. We try not to give medical advice. Well, we don't give medical advice, and we try not to imply that Remag is a drug. But it's difficult because, as you see in Ginny's blog of this week, which you can find in all its glory at drcarolyndeanlive.com, 2018 year-end review, 65 health conditions. Now, merely by saying that magnesium deficiency is related to 65 health conditions, the FDA could very well say, well, you're saying that magnesium is a drug and can treat 65 health conditions. But no, I disabuse you of that idea, because we are saying that magnesium deficiency is very stupidly, and I'll repeat that word, stupidly, being misdiagnosed as 65 health conditions, disease conditions, actually. They're not even health conditions. We give the magnesium Remag necessary to support the structure and function of the body so that you don't dive into the spiral of what? Acid reflux, adrenal fatigue, Alzheimer's, angina, what are the rest of the A's, anxiety and panic attacks, arthritis, asthma. In the blog that Ginny wrote, she cut and pasted out these 7 conditions from the Magnesium Miracle 2017, and the book goes on to list 65 conditions. And it's interesting because even though we say Remag can help everything, Remag is responsible for the activation of 700 to 800 enzyme systems in the body, and just take it because you don't even know that you're suffering from magnesium deficiency until you no longer have magnesium deficiency. And even though we say it'll help with everything, sometimes we just have to say all the things that'll help with, and I'm going to do that. Jenny, I'm going to go through the 65 conditions. So here we are. I've already said acid reflux, and that's because you can get a spasm of the lower esophageal sphincter that leaves your sphincter open and allows stomach acid to burp up. That's it. So if you don't have that spasm, you don't have acid reflux. Can be other reasons for acid reflux, but let's start there. Adrenal fatigue. When you're stressed out with anxiety and panic attacks, you use up a lot of adrenaline, and that uses up your magnesium. And then there's a vicious circle and cycle without magnesium. Alzheimer's, that's because magnesium blocks the neuroinflammation caused by calcium being deposited in the brain or heavy metals building up in the brain. Magnesium can help get rid of those. So there's layers and layers of how magnesium is going to help on all these structure and function problems. Angina, which is the muscle spasms in the heart. I've mentioned anxiety and panic attacks around adrenal glands. Arthritis, well, what if your arthritis is the calcification in joint spaces? And what magnesium does is it helps dissolve calcium in places it shouldn't be and directs that calcium to the bones and teeth where it should be. There's asthma, where a couple layers of help there. Histamine production and bronchial spasms are both related to magnesium. So magnesium actually becomes an antihistamine. And the bronchial spasms, that's the smooth muscles of the bronchial tract, get all tightened up and cause wheezing. Magnesium deficiency. Our atherosclerosis, that's the calcium deposits in all the arteries in the body, the coronary arteries, the carotid arteries in the neck, the kidney arteries. There's blood clots. Magnesium is like a natural blood thinning drug, but it's not a blood thinner. It helps balance the blood clotting factors. You know what the biggest blood thinner is hydration, because people don't drink water. Their blood gets thick and sludgy. So you start with your water guidelines, which we reinforce all the time with our customers. And there's bowel disease, where especially constipation can be a result of magnesium deficiency. The magnesium is very important for balancing brain function. There are whole books written on this you can get for free online. There's teeth grinding. There's cholesterol elevation, chronic fatigue syndrome, cystitis, the spasms of the bladder that can hold in bacteria and lead to even a bladder infection can be a magnesium deficiency. Depression, being toxic, because magnesium is a great detoxifier, the way it helps the liver in the P450 detox pathways, the way it helps eliminate heavy metals. Diabetes, even in medical books, they say magnesium deficiency is an indication of diabetes. Fatigue, yes, with the ATP production, adenosine triphosphate, you need magnesium in 6 of the 8 steps to make energy, so that's the first thing you turn to if you're fatigued, rather than sleeping pills or anti-anxiety medication. Headaches, even migraines, are definitely a magnesium deficiency in a lot of cases. Heart disease, hypertension, hypoglycemia, indigestion, inflammation, insomnia, irritable bowel, kidney disease, and what do we hear many times today in customer service is people who've been told they have kidney disease and they should avoid magnesium. And that kind of myth seems to have come from episodes where people are iatrogenically given too much intravenous magnesium, and the magnesium builds up. It can't clear the kidneys fast enough before it causes side effects, usually rhythm problems. So magnesium doesn't hurt the kidneys. It's just that if the kidneys aren't clearing massive doses of magnesium, you could have a problem, but you're not going to be taking massive doses of magnesium. So that's a real irritation in my world. And even our friend Dr. Jason Fung, he's a nephrologist. He deals with dialysis patients all the time. He says he puts people on IV magnesium because they're twitching and palpitating, and they're losing magnesium in their dialysis treatment. There's kidney stones. Calcium in the kidney stones can be solubilized by enough magnesium. All the musculoskeletal conditions, I even say fibromyalgia is 50% magnesium deficiency, 50% yeast overgrowth. So in the musculoskeletal, you've got your muscle cramps, fibrositis, fibromyalgia, GI spasms, tension headaches, any sort of muscle spasm or muscle contraction, all the chronic neck and back pain, even jaw tension and teeth grinding, any sort of nerve problem, the neuralgias, neuritises, neuropathies for which people are either told, well, you could be developing multiple sclerosis, or they're just given drugs like Neurontin, which I don't know that they're addictive, but they're very hard to get off. And at a certain point, they're actually causing more problems than they're helping with. And in the nerve problems with magnesium deficiency, you're looking at burning pain, muscle weakness, numbness, paralysis, pins and needles, seizures and convulsions, skin sensitivity, tingling, twitching, vertigo, and confusion. Then we get to all the obstetrical and gynecological problems, premenstrual syndrome, painful period cramping, female infertility because of fallopian tube spasms. The sperm and the egg can't get to where they want to go, so you have infertility. premature contractions in labor, in pregnancy, premature contractions, and then the preeclampsia and eclampsia in pregnancy with the fluid retention, high blood pressure, and seizures, all of which are known magnesium deficiency symptoms. And you put up an IV magnesium drip, and these symptoms go away. And that knowledge does not get translated to people who have edema or high blood pressure or seizures to tell these people, just take magnesium. Nope, it's got to be a drug. Cerebral palsy can be caused and aggravated, exacerbated by magnesium deficiencies. Even sudden infant death syndrome. Infants can develop spasms and just stop breathing due to magnesium deficiency. And it's simple enough for a mom to be taking Remag during her pregnancy to avoid all that. Male infertility, that's magnesium and zinc deficiencies that can be treated. Osteoporosis, low magnesium in the presence of elevated calcium with or without vitamin D triggers a cascade of events leading to bone loss. And that's osteoporosis right there. Then there's Parkinson's disease, and that's a dopamine deficiency where magnesium is a required cofactor in the production of dopamine. Also, magnesium will help block the neuroinflammation caused by calcium and heavy metals. Brain of spastic blood vessels in the fingers mostly. People with sports injuries can really benefit from magnesium. There's sports recovery. There's temporomandibular joint syndrome, spasms, tongue biting, tooth decay. And I don't know if I'll ever do another updated Mag Miracle book, but I'd be putting in the ciprotoxicity, people who are being floxed with fluoroquinolones that have the fluoride element in them. And the fluoride is put in there, or the fluorine is put in there, making a fluoridated compound to help a drug get across the fatty membrane of cells. It's to help cellular absorption. It makes them very powerful and very toxic because, as it turns out, these drugs, when they're broken down in the intestines by the trillions of bacteria in the intestines, it can release this fluorine atom that binds irreversibly with magnesium, and you've got someone who's just been working out and they're already magnesium deficient. They take a Cipro drug and it binds up any of remaining magnesium and their muscles go into spasm, and if they continue to work out and exercise, they can actually rupture a tendon. And these are warnings. They're called black box warnings. Just what they are is, like a 6-size font, like a font you can't even read on the drug label, with a little black line around it, and that's the warning you get for these potentially fatal occurrences. So that's the 65 conditions. A lot of people will see themselves in that list, and this is where you just run, don't walk to your nearest computer and start working with Remaing. So that's Ginny's blog, and I'm going to stop and ask Ginny if I've said quite enough so far.
You have said the 65 conditions, which I'm very happy about because we can't say them enough. It's I just remember the very first time that I had the aha moment that it's not a magnesium, it's not atrial fibrillation, it's a magnesium deficiency. To put a disease name on top of a nutritional deficiency is really the screwy part of this whole situation. And so, if people have had any kind of anything that's on that list, like Carolyn always says, it's magnesium deficiency until proven otherwise. And before you run out the beta blockers, which we should, You know what we should do? We should take that list, and then we should do a side-by-side comparison of all the side effects for the go-to drug, Carolyn, because let's just talk about Prilosec, kidney disease, all the other side effects from using Prilosec, and all the those PPIs that everybody uses every day. And then let's put the side effects, quote unquote, of Remaing, of which there are none. I mean, so people, so people don't even know. Let's side effects of beta blocker, side effects of diuretics, side effects of this, and put those side by side. Side effects of anesthetics and anesthesia to control certain circumstances. I mean, it's such a quagmire, which is why we can't say it enough, talk about it enough, and encourage our listeners to talk about it as well. Now, here's a couple questions on here for you, Carolyn. One of the people was asking, is it possible for Remaing to help build heart muscle after a massive heart attack?
Well, Remaing is a building block of the cells, but you can't expect it to do all the heavy lifting. And what we've seen is in the ejection fraction of the heart, which measures its ability to pump blood. We've seen that improve dramatically with people who do the whole protocol, because we talk about magnesium, of course, the building block, and the Remaing has the 12 minerals, all necessary to build cells. And the restructure protein powder with the RNA reset powder in it, which we know is a catalyst to perfect cells, and taking the RNA drops themselves. So if you do the whole, what we've been calling our total body reset bundle, then you can build a whole new body. If you have the building blocks, you can build a whole new body. And I used to say it takes 7 years, because that's how long we thought it took to grow new nerves and sort of brain neurons. But apparently it's even a shorter time than that. So I'm not telling this person on chat that, yes, we can build your heart muscle. We don't do anything. You do all the work. You take the building blocks, and then you direct your heart to become new and follow the basic blueprint of your DNA. So that's what we say. Right, Ginny?
Yes, and did you mention the taurine and realign?
Oh, yeah, realign, of course. Yes. That's definitely a heart. It's sort of it's a type of amino acid. I know I always call them an amino acid, but it's a sulfur-based non-essential amino acid, which is getting more and more essential because of what it does for the heart and for so many other functions. So everything we have in various of our free ebooks, I talk about all the complement formulas and how they interact and help the body on so many levels. Every time some condition comes up or some other new supplement comes to the fore, we just say, well, we're already doing that. We've already got that covered. And when people kind of understand that they don't have to get into very expensive esoteric type supplements that, have all this woo-woo behind them, if they just stick with the basics. Because how many times have you seen someone talking about some new miracle treatment and they go on and on about all the antioxidants and how you need them all, and they don't even talk about magnesium? You cannot have a good protocol without magnesium, and then you can't have a good magnesium without Remaing. That's it. That's the bottom line in our world, and we're discovering that day by day with our customers. It's a huge clinical experiment that we're doing.
One of the things, excuse me, that somebody typed in, Carolyn, Well, and let's just say this before we go on about the heart muscle thing is, if you've had a severe heart attack, I mean, wouldn't you say your body's under so much stress? I feel like, you know, when you can support the body, the entire body, I mean, our protocols support the entire body. So if it is under the stress of a health recovery, like a massive heart attack, you've got to think about your whole body. You just can't think about your heart. It's challenging not to, but you've got to think about every single cell is doing the heavy lifting to get your body back into shape. And I just kind of had that own experience myself years ago when I broke my ankle, and I felt all the energy in my body just kind of go to my ankle. And then it just stayed there for like 6 weeks until my ankle healed, and then all of a sudden all the energy in my body came back to the rest of my body. And it was like focus, focus, focus. And so use the formulas to support your entire being, and your heart will benefit.
Right. Yes, and medicine always just focuses on the one area and leaves everything else out. Let me go over this question that we got today and in the mailbag. It sort of illustrates a bit what we're talking about. This woman says, a close friend has been on Remaing for a year now for general health after recurrent kidney stones. It has been working well, but he developed very high blood pressure after, she says, electroshock therapy on a large kidney stone. Now that's, it's called shockwave lithotripsy. It's high-energy shock waves that they do from outside your body into your kidneys to break kidney stones into tiny pieces that can then be passed in the urine, and that takes a couple of months. So anyway, he developed very high blood pressure, 190 over 130, and that is high. And he had an echocardiogram, stress test, ultrasound on his carotid arteries, showed no plaque, no structural problems. He was treated with IV chelation 6 months ago, chelation to remove calcification and plaque. He had 6 treatments, and his blood pressure decreased to 140 over 100. Then it was back up to 190 or 120. He reluctantly started on statin drugs, 40 milligrams a day. I don't know why they gave statin drugs. It's just they wanted to do something maybe. She doesn't say what his cholesterol was, but statins don't treat blood pressure. So I don't get that. But it's like doctors feel they have to do something. She says his history is significant for a lifetime of surfing and dehydration, mercury poisoning 8 years ago, which was treated. Blood levels went to normal. And so now what we find out, he's only taking 1.5 teaspoons of Remaing, 1.5 teaspoons of Remaing. So he's just on, just over the maintenance dose of Remaing. So that's really not going to be able to treat a really severe magnesium deficiency that could be causing high blood pressure. But what I want to say about when your kidneys, which are your ancestors, it's where everything begins in your kidneys. The kidneys develop first in the fetus. Kidneys are very important. When you take a shock like that to your kidneys, something's got to give, is what I'm thinking. And what I would say to this person is to definitely double up at least on the Remaing. The Remaing can stay at 1.5 to 2, but I personally would be taking 3 and 4 teaspoons of Remaing with that blood pressure, especially now that doing statins, and the most common statin is a fluoride drug, so you're going to be losing magnesium that way. And I would have a consultation with our total biology practitioner, Dr. David Holt. When I look up the total biology of blood pressure, let me just quickly go there. The total biology is about your being in your home and being in control of what's inside your home and what's outside your home. So here's the words. Blood pressure, high blood pressure in men. It's something outside the house that they consider their territory that they want to conquer, and that's pressuring them. Their territory outside the house is either being taken away from them or they're not in control of it anymore. And certainly just the mere fact of having that high blood pressure implies that you're no longer in control. Modern medicine is in control of you. They're trying to tell you you're going to die and you have to take all these drugs. So you're feeling out of control. And with the kidneys, too, there's a lot of correspondence with ancestors and feeling supported by your ancestors. So that's what I would be doing. It's kind of our way with the mental, emotional, and physical. We say all these mineral support, and they support the physical, mental, and emotional. They do. They really do. But then instead of going into any sort of psychology or emotional reasons for having conflict, we just go to total biology, which is the conflict basis of disease, and figure out, well, what is your body trying to solve by putting you in this pressure cooker? And certainly being attacked by shockwave therapy in your kidneys can result in some reaction that's really not documented. I don't see this as a common side effect, but a person perhaps with some sort of issue already gets this done to them, that it can just magnify that issue. So that's the way we roll here, Ginny. We do the structure and function of the body, mind, and spirit, and then we look at the conflict if that becomes necessary. Over to you.
Absolutely. So maybe we've already answered Alan's question, who typed in on the chat. Does my recent spinal compression fracture indicate I need Remag and that it will assist in my healing?
Well, if it was a spontaneous fracture, I don't know, you haven't indicated what caused it, but spontaneous, right. It's an indication that your structure is not supporting you. You don't feel supported in your world, in your life, with your family and ancestors. And, I could say all these words. We don't know if it means anything, but rather than doing the woo-woo first, we say, yes, take the minerals that support your structure and function. And that would be the Remag and the Remite. And certainly the B vitamins and the amino acids in the Realign are going to be helpful. We never say Remag is the only thing you should take, although we use that as a way of educating people and getting their energy back, getting them sleeping, getting some control over their pain, so then you can take action on the rest of your symptoms or the rest of what you'd like to balance out. And always remember, the body has priorities. It's going to work on what it wants to work on, not what your mind wants it to work on.
Very good. Excellent. And then also an interesting question about, and we don't talk a lot about longevity per se, Carolyn, but when it comes to skin tags and age spots and these kinds of things, do you think that they're related to magnesium deficiency?
I think so, because if you look at one of the major signs of aging, just the way the knuckles get all calcified underneath the skin and kind of deformed, that's too much calcification and not enough magnesium to dissolve the calcium. There's in my trying to find the area in my book. I mean, we talk about aging and go over the doctors in Paris who rate from the 1900s were saying that magnesium deficiency and calcification are the major sign of aging. And skin spots and all, well, that's sort of the liver, the age spots they call on the hands. They call them liver spots. I know I burnt one, the top of one of my hands and not the other one, and that burn has caused a lot of sort of the brown freckling that I suppose people could call age spots. So it can be from sun damage, a lot of what we do to our skin. So I know I didn't answer the question specifically, but again, you know, people keep saying, well, magnesium take care of all this. It's not just magnesium. It's our magnesium and Remaing, Realign. It's the whole picture. And then to boost the immune system, we have added the Pico Silver, and that's having tremendous results with people.
Nancy typed in, I'm listening to the show, do statins deplete magnesium due to them having fluoride in the statin?
Yes, I think so. Definitely.
Okay, very good. Excellent. Okay, so now let's also announce tonight we do take phone calls. 602-666-6027 is the number to call if you want to talk to Dr. Dean tonight. And you've got to hit *5 on your keypad to raise your hand, wave your hand to me, and let me know you have a question or comment. And we do have a caller holding, Carolyn. Do we want to take some phone calls?
Sure, yeah. We're on top of it today. We can start early.
Okay, very good. So let's go out to area code 310. 310, you're on the line with Dr. Dean. If you could give us your name and then state your question or comment.
Hi, are you with me?
Yes.
Yes, hi, Dr. Dean and everyone. This is Shirin. I have a question. A friend of mine, her daughter was diagnosed by PCOS, which is it's a kind
polycystic ovarian syndrome. Is
yes.
that the polycystic ovarian syndrome? Yes.
Yes, that's what it is. She's a young girl, and she wanted to know what to do about it. Does magnesium, Remaing and Remaing, or anything that can help the situation, please?
Yes. PCOS, polycystic ovarian syndrome. Have I written about that? I probably have. I was going to write a book on it once, but I never got around to it. Right. It's insulin resistance. It's medically they talk about the insulin resistance and put people on diabetes drugs right away, metformin.
Yes, that's what the doctor said.
Right.
That's what the doctor said. But she doesn't.
What I've done with PCOS, Sharon, is I did a summit on it. And if you Google my name, magnesium, PCOS, there's information I've written about it. And it is balancing the hormones, which will happen if you're working on balancing your thyroid and your adrenals, and that means the sex hormones will balance out. It's balancing the blood sugar. I think the ketogenic diet would be very good in this instance because of what PCOS does with insulin resistance. If you stop eating carbs, you stop stimulating insulin, and you stop that whole vicious cycle. So it's a matter of looking at our, I guess, the Remaing book, the Remaing book, looking at, as I said, Googling what I've written about PCOS. But we end up saying the same thing to just about everybody. Do the basic formulas, do either the yeast diet or the keto diet, and start feeling better.
Hello?
And then if you still have questions, you can get back to us. Are you still there?
Yes, I'm still here. Can you hear me?
Yes.
Okay.
Yes.
I have another question, Dr. Dean. My father, who has CLL, following the infusion therapy, like 3 weeks ago, I don't know if it's because of that, he fell on his back, and he opened, it was cut open his head. So we took him to emergency room. He got stitches, and because he was on blood thinners, he lost a lot of blood. A lot of blood. And following that, they took him to ICU because of the fluctuation of the pulse and very low blood pressure and all those complications. And after he came home after 2 days, lo and behold, he got pneumonia from the hospital.
Yeah.
So he was admitted back to the hospital to be treated for the pneumonia. I'm here right now with him, and they gave him 3 kinds of hefty antibiotics and blood pressure and I don't know, you name it, a lot of things. So I did prepare the magnesium, and I gave him every day, magnesium and Remite and Remag. And right now, for today, I brought him double the amount, like 2 teaspoons of each, to give him all day long. I wanted to know, what do you suggest that I do at this point?
Well, I can't talk medically. People could be listening to this radio and accuse me of practicing medicine without a license. What you do is look at the silver report and see what you think about using Pico Silver. The silver report is at a third-party site, drcarolyndeanlive.com. And you mentioned CLL. For the listeners, that's chronic lymphocytic leukemia. And people with leukemia related to the blood, there's something going on with the family. Blood is family. And so it's to reassurance that the family is there, the family's taken care of. He doesn't have to extend his blood in order to take care of the family. Everybody's taking care of each other. So that has to be acknowledged. Dr. David Hogue can help, but I know a lot of people don't want to go into that sort of consultation, but that's the truth of it. Yes, sir. Am I cutting out because you're in the hospital with all kinds of...
Yeah, I'm getting out of the hospital right now. I was walking to get out here. All right.
Right.
Okay, now I'm in a better place, I think.
Yeah, look up Pico Silver, and this is the type of information, maybe you could email us about. We cannot give medical advice.
No, I'm talking about supplementation. I know this is not a medical thing, but as far as supplementation goes, if anybody in this situation, would you quadruple the amount?
The structure and function of the body can be supported with all our formulas, and for anybody at any level of health or illness, you would just use them and consult the archives to see what we talk about there. Use the maximum doses as much as you can. Certainly, you've heard me talk about my heart palpitations. I had to use 4 teaspoons, and I'm not a big person, so there are many things that you can do.
All right. Okay. Thank you. I think I got...
Okay, sure. Okay, then keep us posted. You're welcome. Thank you.
All right.
Bye.
Thank you. Bye-bye.
Ginny.
Excellent. Live with Dr. Carolyn Dean here on AchieveRadio.com. Thanks for tuning in, everybody, this evening. And again, if you have questions or comments for Dr. Dean, the dial-in number is 602-666-6027. You can also Skype in at ar.call.in if you want to use your Skype. Let's see. And if you are on the phone and you want to talk to Dr. Dean, you've got to hit *5 on your keypad to raise your hand. Otherwise, I won't know you're there, and I won't take your phone off of mute, and you won't be able to talk with Dr. Dean. On the chat line, Carolyn, we had one of our regulars type in and ask about her niece in Europe that's not able to call in. So she sent a question in. And apparently a month ago, she became extremely fatigued while at work. She was persuaded to go to her doctor to check her thyroid and found a nodule. So now it's developed into a much larger nodule, and she's depressed and anxious. And she said that she isn't willing to take anything other than your complete body reset. Should she start on the Remag and Remite? I wanted to tell her the complete, but I will leave it to Dr. Dean, who is marveling to tell her what to do, but she's saying Dr. Dean could tell her. What's the best resource for her to look at if she's got a nodule on her thyroid?
Well, what we would do is look at total biology, and I don't know if that's been accessed yet, but I've said it a few times that the thyroid is the thyroid takes care of time and speed. And when someone produces a nodule, it can either be a nodule that's producing more thyroid hormone, which would start to make a person hyper, but if it's fatigue, then it's the thyroid nodule taking over the area and not producing any thyroid hormones, which would cause the hypothyroid type of symptoms and not have enough thyroid for metabolism, etc. So I would look at what are the reasons that a person wants to slow down their thyroid. The words I have in my total biology notes, it's a woman. Oh, this doesn't help. Oh, there's a case of a woman doctor in California. She was the patient. In August, she found out that her father is going to die, and she developed hypothyroidism. And she's exhausted. She has to give up her practice. She talks to my teacher about her symptoms. They talk about the conflict that her father's going to die. She starts to feel better, and she's mostly back on track in a few months. And what they realized, or what she realized with my teacher, is that she became ill in August when she found out her father was going to die, to slow down the time so that him dying in 3 months would not come as quick. And it sounds strange, a lot of this total biology, but it's like the primitive brain takes over, and it's like, oh my gosh, I don't want December to come. I'm going to slow down my metabolism, so I'll slowly get to December. So that may or may not resonate with your niche, but it's something to consider. Like when something happens all of a sudden, what is going on in the rest of a person's world or their environment? And of course, at the same time, you're going to be doing the Remag and the Remite, and the Remite has the 9 building blocks for the thyroid hormones. And I would keep in touch with the doctors to do the blood test, do the ultrasound, do things to find out what's going on. The vast majority of thyroid conditions are not dangerous, but I will never tell someone not to get testing. So Remag, the Realign will help detoxify. I would look at yeast overgrowth, too, because that can block thyroid hormones. And read my Reset. Well, there's Reset the Yeast Connection, but there's also Total Body Reset for the Thyroid. And that book will go over quite a bit. So that's a start. Okay, Ginny?
Yep, absolutely. Excellent, excellent, excellent. Okay, another caller holding at area code 480. 480, you're on the line with Dr. Dean. If you could give us your name and then state your question or comment.
Hello, my name is Kay, and my question is, I'm on bioidentical hormones. I'm 65 years old, and I've been having replacement therapy for my hormones, progesterone and estrogen, bioidentically, and also my thyroid, which I've had been on medicine or bioidentical medicine for that for about 20 years. Is this continuously leaching magnesium out of me? Because I am on your Remag and your Remite. I'm on Restructure, your Realign, Pico Silver, your cod liver oil. So I'm doing all of this, and I'm wondering if I should be increasing my Remag and Remite. I had been up to 4 teaspoons, half of that being Remite, and now I'm kind of around 3 teaspoons a day. Is this something that I should continue on a maintenance level because of what the meds that I'm on?
Right. Is it pills or creams you're on, Kay?
My progesterone is a cream. My the estrogen, etc., is in troche. That's the opposite. It's the other way around. My progesterone is a troche that I dissolve under my tongue at night. And then the estrogen is in both morning and night in a cream.
On your skin or vaginal?
My skin.
And how are you feeling?
I'm feeling fine. I know I could lose about 5-10 pounds, at least probably 10. And I just, I have pretty good energy, actually. I sleep really well. I sleep between 8 and 9 hours a night. You know, by the time it's 9 o'clock at night, I'm yawning and I want to go to bed. But it takes me a while to wake up, but I get going and I don't take naps. I don't feel the need to.
What about exercise?
I've been walking. There was a time, I've always been pretty active, but for the last, just until recently, I got kind of lazy. But I'm now back to walking, and I like yoga, but my yoga teacher moved, and so I kind of stopped that. When it's nice, I can swim. I'm in Florida here in the winter. So,
are you happy? Kay, are you happy?
I think so. Funny you should ask that.
See, you've got everything. You're doing everything. You've got everything going, and you're focused on taking care of yourself. But you know, I just sense there's something missing. I don't know. I mean, I don't know you, but
right.
It's like let's find something that lights you up, that you're passionate about, and that you can just be giddy about. I don't hear enough giddiness. And then, okay, are you on the RNA drops?
I'm out of them. I had finished my second bottle. I also got the RNA serum. Can that be ingested orally, by the way?
No, there's some rose oil in there, and it tastes a little bit yucky, so it's better on the skin. Do you recall, Kay, when you were on the RNA, we call them RNA reset drops, if they gave you a little bit of detachment and gave you a little bit of bliss?
Well,
That's what
it's interesting. Yeah, right. I'm planning tomorrow to order more, and I'll pay attention to that. Because I wasn't real consistent. I wasn't consistent.
Right.
You know, I'd have it in the morning, and then maybe I'd forget the next day, and then I'd have it for a week, and then I'd forget a few days. And
yeah. Okay, so here's what I'm going to say is now that you, and you know what you're doing with the bioidenticals, that sounds good. What I do say to people is maybe take a little less than the doctor says. We don't need as much as they say, but you would notice if there was too much of the bioidentical estrogen cream, if your breasts got a little tender. The moment they get tender, then cut back. And so what I'd say is things are kind of covered. Maybe you could experiment with the keto diet to lose a few pounds, because I know even a few pounds is kind of a burden, even mentally. And then look at the RNA reset drops as a thing that will turn you on. And look at that as this is my meditation. This is me in my next life. Okay?
Okay. And how much? Like a few drops a day?
Well, stay on over the commercial, and we'll talk. We'll continue on. Okay?
Okay, that'd be great. Thanks.
Good.
Psychic radio, holistic radio, spiritual radio. This is AchieveRadio.com. Follow us on Twitter at twitter.com/AchieveRadio.
AchieveRadio.com. The future is now.
Here we go now. Go to the Carolyn. Here we go now. Here we go now. The wellness scene with Dr. D.
Psychic radio, holistic radio, spiritual radio. This.
Welcome back, everybody. Hour 2 live with Dr. Carolyn Dean here on AchieveRadio.com, and we're joined again by Dr. Dean and also our caller from the first hour, Kay. Welcome back, ladies. What do we have to say?
Thank you.
Well,
Hi.
Kay was asking how many drops to take, and we do outline that when you get your bottles. It'll tell you to start with just 1 drop a day and take that for even just 1 drop a day for a week, and then add another drop. So it's just very slowly. Put yourself on a schedule, and as I was saying at the break, just make this your meditation and your focus for bliss, and get yourself a nice affirmation to say about what the drops are going to do for you or what you want them to do for you. So does that sound too woo-woo, or does that sound?
No, not for me. Not at all.
Okay.
No.
Then
so I just put them.
drop.
Yeah. What I did before is just I kind of hold it away from my tongue so it doesn't touch my skin, and I put a drop on my tongue. Is that about what you do, or should I put it in water?
You can put it under your tongue so it'll be absorbed sublingually. I know when Bob first started, he would stand in front of a mirror so he would drop it in properly.
Yeah.
And the whole thing is he's just saying not to touch the dropper with your tongue, just not to germ it up. That's all. Yeah.
Right.
But some people will put it in water. I mean, you can just create your own ritual. If it sounds too stupid to stand in front of a mirror and watch your tongue, and if you brought up the idea about doing it in water, get a nice little shot glass, put a little bow around it, put in a half an ounce of water, put in your drop, and then sip that as you would fine wine.
And then real quickly, do I need to keep it refrigerated? I always have, but is that necessary?
Yes. It's better if you do, but certainly I travel all over the world with my drops, not in a refrigerator, and they're just fine. But since it's a food product, that's what we put on the label.
Okay. Well, thank you so much. I appreciate it. All right. Thanks for your time.
That was good, Kay.
I love your products, by the way. Okay.
Thank you. Appreciate it, Kay. And thanks for phoning in.
You're welcome.
Bye-bye.
All right, everybody, wonderful. Hour 2, again, looming in. And if you've got a call or question for Dr. Dean, 602-666-6027 is the number to call, and we'll put you on the phone with her this evening. Okay, Carolyn, back to the chat line. An interesting question from Nancy. Now, this, again, not our Portland Nancy. That's Nancy, different Nancy, but this is another Nancy, and she's saying, hi, I have another question. Do the Remag, Remite, Realign have the ability to remove plastics from the body? As I eat fish often, although it's wild and smaller fish, they seem to contain plastics from the plastics that they get in the ocean, salmon, cod, Dover sole.
Well, I don't know about that. We haven't obviously done any studies on that, but what I do say is the building blocks of the detoxification pathways do help to remove foreign bodies and chemicals and heavy metals and all the rest of it. But the other aspect of what we say, especially when working with the RNA reset drops, is we can get our body to do whatever we want it to do. And we don't limit ourselves, and we ask our body to adapt, adopt, and survive, and we tell our body that it's perfect and perfecting, and that we're not going to be undone by what people consider as being all the negatives in our environment. I just no longer read about all these negative things because I know I'm doing the best for my body by taking the products, especially the RNA reset drops, and by not being overly concerned. There's so much that we could potentially worry about in our world, and why bother? Because that doesn't change anything. What changes things is when you take action, do the products, just hold your good attitude. I mean, that's what I was getting into with Kay. We want you to be happy and blissful, and you can do that. But you will drain yourself if you do worry about environmental toxicity, because that is not going to end.
Yes, and you have a great blog that you've written, Carolyn, and I'm going to post it in the chat line. It's called Adopt, Adapt, and Survive. And it's back in 2014, but it reinforces the point of what you just said, that we've got to look to adaptation, I mean, it's well proven that the human race does survive. As a matter of fact, biologically, epigenetically, the scientists have shown that human beings can be born without any arms or any legs and still survive. And at a biological standpoint, our race succeeds. So, there is adaptation in all of us, and there is a way to navigate through the environment, as Carolyn said. So I posted it in the chat line for you and for all of our listeners. And if you miss it in the chat line, you can just Google Adopt, Adapt, and Survive Carolyn Dean, and you'll find the original blog.
Mm-hmm. Excellent. Good for me.
Good for you. Yay. Oh, wait a minute. We just haven't had enough of these lately. I thought we could talk for a minute about our Doctor to Doctor series and just the doctors that we had on this year and kind of how they also reinforced your position about magnesium, Carolyn. Do you have any highlights or anything that you'd like to share about that?
Right. It did strike me with most, if not all of them, that they had an inkling, or even more than an inkling, about magnesium, but they really didn't know enough about Remag and how over these past few years we've been proving over and over again that the more magnesium that your body can take without getting the laxative effect, the more layers of health you can develop, and the more layers of illness you can get rid of by saturating your body with something that it's been deficient in. It really struck a lot of them as being very powerful and very important. And it's something we're going to continue to work on, trying to educate more and more people and more practitioners about this, and to try to get them into the fold, bring them into the fold, so that like our Dr. Princetta, who's a real fan of the products, just get them to use it so they'll become better practitioners because they're truly helping their patients. So that was the basic. Mm-hmm.
Yeah, we had great doctors too. We had Dr. Hotze come in, and also he talked a lot about the thyroid and reinforced the importance of Remaing. And we had Dr. Holt come in and do total biology. We had our good friend Barb Schlitz, who came in and talked about nutrition and did almost 2 hours with you. That was a fun show. That was back in March. We had Andrew Saul come on, Carolyn, and that was really fun.
Yeah, and all these are in the archives, all these, the doctor series. I guess what we could do is send out a blog. Probably next year what we'll do, we're not going to continue the series. Ginny and I are going to embark on some iPod tapings. So what we'll do is probably periodically put out a blog telling you about to listen to one of the archives of our doctor series, because they had a lot of good things to say, and they were all very interested in Remag, that's for sure.
Yeah, we had Dr. Northrup come on, and she actually takes Remag Remite and the Total Body Reset, so that was fun. And we had Dr. Sinatra come on, who we totally love and is a big fan of yours, Carolyn, and has written the part of your book. And, of course, Dr. Jason Fung. We wrapped up with homeopathy. It was an amazing series. If you would like to, or if you missed any of those, you can just go to drcarolyndeanlive.com and type the word doctor to doctor in the search bar, and it should bring all of them up. But it was the first Monday of every month, and I don't think we skipped maybe 1 month, maybe July in the summer or something when Carolyn was in her international travels. But other than that, we were pretty faithful to the schedule. So you'll probably love listening to those. As Carolyn said, we can feature them again next year. Really, really good content.
Mm-hmm. Right. We had Shakaya on, and she's a reformed raw foodist who realized that the more strict she tried to be as a vegan to do it properly and get healthy, the sicker she became. And I think she's either an A or an AB blood type, which I used to give a generalization that A's and ABs seem to be okay with the vegetarian diet, but it just wasn't working for her. And she's recently told me she continues to improve and be well, and certain test and blood factors that were abnormal for her are starting to improve. So that was a very important interview that gave a reinforcement to what I've learned over the years, that not everybody can be a healthy vegetarian or vegan, and a lot of young people these days are going that road, and it's occurring at a time when the plants don't have the minerals and the food is contaminated to a large extent, and the supplements that people take are not as absorbable as our supplements are. So a lot of good information. And Shakaya, her stage name, her internet name is Shakaya Breeze.
Oh, yeah, wonderful.
The date of that, was that October?
That was October, yep, and we had Roby Mitchell come in, I think, too, Carolyn. He was back in June, and that was really fun because he did a lot about digestion and that kind of thing, and that was a really great show, too. So lots of good content there for anybody who needs a refresher on those. Feel free to go to the archives and pull those up. Very exciting.
Yeah.
Okay, so...
And the webinar series, too, let's just tell people about that. We did a lot of webinars this year, and that's another thing that we might sort of pull back from, because we covered most of the topics that we wanted to cover. We tend not to do things just to do things. We do things because they make sense, and we will be kind of reinstituting the webinars if we feel that there's a topic we have to cover. But in the meantime, you can go to the webinars on YouTube and look at those. They're also good to send to people who don't like to read and like to watch things. You can send them on to folks, because we cover thyroid and general hormones and diabetes and all kinds of things. Heart disease, atrial fibrillation. Yeah. I mean, we've done a lot, because we did the diet review, we've done Labyrinth of the Mind, we did fibromyalgia and chronic fatigue, a daily detox one, boost your brain and clear your energy. We've done all kinds of healthy holiday strategies. We did the Reset Your Ideal Weight with the Keto webinar, which is fantastic. And, of course, again, on the healthy heart, diabetes is reversible. So many. Gosh golly. Okay, I'm going to put the link into our YouTube channel here in the chat line, too. And but it's on there. Just Google Dr. Carolyn Dean, Total Body Reset, and you'll find it. And, gosh. And so let's just talk. We've invited other doctors to the conversation this year in 2018. Tons of revamping of the books. You've added new books this year. You did a book on Realign. You did the whole series on homeopathy, which was incredible, that we just have done recently. You did all the work with the keto diet. Tons of instruction and information about magnesium, insulin resistance, type 2 diabetes, type 1 diabetes, the metabolic syndrome, and how that's magnesium deficiency related, or magnesium and mineral. You did Reset the Yeast Connection, all the information on the yeast overgrowth and how people can control that aspect of their health. We've had so many incredible testimonials, Carolyn. My golly gosh. I mean, the amount of health recovery. It's exhausting what we've done, Ginny. It's a good thing we're on our products. It's just so exhausting. I'm going over all the books now. Remag is in its 10th version, and we've got 11 free ebooks up there at drcarolyndeanlive.com, and actually a couple weeks ago when we featured our homeopathic kit, I put the Future Health Now Encyclopedia up as a free book because in the book I do talk about our products, but I also talk about herbs and homeopathy, and I just want people to have that resource so that they'll go to that book first before rushing to the emergency department or their doctor, unless you're totally bleeding out, then that's an emergency. But if you have a health encyclopedia and have an idea of what to do or take, then it puts you more in charge of your body. That's what all these free ebooks are about, is to put you more in charge of your body so that you don't just depend on doctors. I mean, I'm thinking of the testimonial I read out a few minutes ago where the gentleman with the blood pressure, and they put him on a statin. And I don't know the reason for it, but they said he reluctantly started on statins. Like the doctors will make you take a drug just because they want to do something for you. And unfortunately, in a lot of cases, they're not doing what's in your best interest. But anyway, I'm not telling you to stop taking any drugs. I know if you're doing our products, it's perfectly safe to take your medications along with our products, and then as you improve and your blood pressure gets better, or your migraines get better, and your cholesterol gets better, your blood sugar gets better, then any sensible doctor is going to take you off the drugs that you don't need anymore. And that's probably what the FDA and the drug companies don't really want to hear, because they somehow have convinced themselves that drugs are what you need for any ailment, even though they're just a symptomatic treatment, and they're really never a cure.
Yeah, never. It's incredible. So we have so many resources that Carolyn has presented, and it is funny, like you said, it's a good thing we are on the products, but honestly it's just been absolute pure joy to do this for everyone and with everyone. And what about we can just reflect for a minute too on our customer contribution, because our customers are our partners in this process, and they give us so much great feedback. They share their testimonials. They tell us when our stuff isn't working. They don't like our packaging, this and that. They, support so many aspects of what we're doing and making our products better, and they share, and encourage their families to get healthy in their same, the same method that they're using. What can we say about that, Carolyn?
Well, I think it's wonderful that our customers are telling us, especially this Christmas, how they are giving their whole family a Remag lotion or the Magnesium Miracle book, and just sort of opening the door for their friends and family, because they're so blown away by how they've been helped. They just want to pass it on, and instead of just talking it up, they're going to just share a product with them, and I think that's fabulous. Some people are getting the homeopathic kit for friends and relatives who show an interest. And the homeopathics are just awesome, and it is fairly easy to use them. You look at the book, the free e-book on homeopathy, homeopathic guidelines, and you download it. It's PDF. It's a searchable PDF. And if you have a cough or a runny nose, you just type in cough, and you look through the book, and it tells you which remedies can suit the cough, and it gives you some indication of, well, if you have a fever along with it, or if you have sore muscles, or if you feel nauseous, and those are several factors that you may or may not have. If you have a few aspects of a remedy, then you do that remedy for a couple of doses. If it seems to help, then you keep doing it every time you sort of stop your progress and you slip back. Say you have a cough. You do the remedy that suits you and your cough subsides, and then all of a sudden it comes up again. Take another dose. This is what Mary Aspinwall was talking about when we did the homeopathic radio show. That was another of our doctor to doctors, where on December 3rd we had the whole 2 hours on homeopathy. And anyway, back to the books and the customer feedback. Yes, we hear people saying to us, what can I do when I need some first aid? Where do I go? What do I take? And we always used to say, take more Remag. And now we can tell people to go to their homeopathic kit. Customer service is not, they're not homeopaths. They're not going to tell you what to take. This is one of the beauties of homeopathy. It is for the individual and for the families, and you look up your own remedy and you try it because it is so perfectly safe.
Yep. Absolutely. Okay, let's see. What else do we have going on, Carolyn? Do we have mailbag and things that we must attend to?
Oh, yes, of course. Yes. I'll go into that now. Very good. But what was the other thing? What products did we bring out this year? We brought out, Pico Silver, and we wanted to bring out our vitamin C, whole C reset, and our Flora Revive, but that'll be in the new year. And we brought up the homeopathic kit. And in terms of customer feedback, what we are so easily able to do is send out a new product to test it on 100 of our customers and get incredible feedback. So maybe other companies do that, I don't know, but it's like Ginny is on a first name basis with most of our customers. It's quite awesome.
Well, I hope they think it's awesome, but we do have a great relationship with our customers, and we do. And it's funny because so many people have been using our products for so long. One of the things that we found out is they're now so healthy that, when we give them a new product, it's like, well, I noticed it was great, but I already feel so great. It's hard to feel much better. So, we're just so thrilled to be a part of so many people's health journey. I mean, honestly, it's just fantastic, And we love the challenges. We do love challenges when people say, hey, this isn't working or that's not working. It's like, okay, we'll figure it out. We'll help, contribute. So we're not afraid of that at all. If you're not getting the results you need, you've got to let us know and we'll help you out.
Yep, right. And here's actually some feedback from a customer. And this is how it goes. Julie Dickey is working with this woman with the Total Body Reset. So she starts out with, I'm happy to report that I feel so much better. She called us about some laxative effect. She says, I took a one-day break from everything so my bowels could get settled down. So the next day, I took 2.5 teaspoons of Remag, 1 teaspoon of Remite, 1/4 teaspoon of Recalcia, and 1 drop of RNA Reset. And the sea salt and 2 Realign, no fiber or bentonite. And she started EFT tapping and used some emotional essential oils. Now, emotional freedom technique is something that we've talked about in several seminars. EFT, you can go to emofree.com and get their free guidebooks on how to tap certain acupuncture points for emotional balancing. So anyway, she took all those suggestions that we gave her, and she said, it's Monday afternoon, about a week after I contacted you. She said she's feeling so much better. And then she says, just went to my chiropractor today, and he muscle tested me and said I had an emotional block in the stomach. Now, I told her, now that's great to have someone to work with on that level. And I said, the mind and the body will prioritize things and bring them to the surface when you're ready to deal with them. And then she said she had no diarrhea, and she even cheated eating sugar. See, this is what's going to happen over Christmas is people are going to, quote, cheat. And I say, well, that's called the experiment. So then she continues, I can't thank you enough for all the support. I've been on this journey for a very long time. The products have cleaned up my system. Joints and muscles are to the point that I have so much more energy than I had in my 30s. No more toxins in my muscles so I can work out again. I've been exercising daily along with using 2 15-minute sessions on some sort of machine she uses. Look here, 60s, here I come. She must be in her late 50s. I tell so many people about your products, but they just don't listen to your radio show. So when they have that bump in the road, they just blame it on the products or say it didn't work for me, and then they stop. I resonated immediately with Dr. Dean's presentations. So I said, we say our products are for whosoever will, because you have to be engaged with them and be responsible in taking them. And she continues, I believe that the products were what I needed, and I was not going to give up until I had a balance point. If you did not give the amazing education on your show that you do, I would not have understood that this could be something other than a magnesium deficiency, because I just kept taking more and more and getting worse. So what she was, it was just balancing the intake so that you don't get the laxative effect, but you get enough of magnesium to work your enzyme systems, but not so much that you're overloading your cells. And it is a real education. I mean, Jenny knows how much work she spends on customer education. What else here? I think being so mineral deficient was my problem and not being able to release the emotional crap. I've tried many other modalities but not with much success. And then I said, you may hear your words on the radio show. And then God bless and happy holidays, Julie, Ginny, and Dr. Dean. So that's the way we roll. We get people to just really analyze where they are with their health. And once you know that Remag is going to be a solution to a lot of problems, and we can really kind of partner with people to, I don't know, I guess it's just be a witness to them getting better, and a witness in our, myself, Ginny, all our customer service people take the product, so we know the mechanism by which it works, and that you just have to be patient. Now, here's something. I'm going to jump to one of the latest blogs, Ginny, unless we have a chat or a phone call.
Nope, that sounds good.
Okay. It was a blog about Botox for AFib. Seriously? ? And someone wrote in, I was neurologically injured with small fiber neuropathy after an injection of botulism toxin from my eustachian tube. That's a tube in the ear. There are hundreds of people worldwide who've been damaged, yet we are being told we are crazy. thank you for bringing awareness of the dangers about the botulinum toxin. Now, have you heard, I don't know if customers have been getting to us about this, but have you heard about that people are getting poisoned with Botox?
Well, you hear it on the cosmetic side, but I didn't know that they use Botox. I mean, you do hear it on the cosmetic side that when people are doing their Botoxing, and what was shocking to me is how young these people are that are starting, 24, 25 years old, and they're using Botox in their face to prevent the onset of wrinkles that happens when you're quote-unquote 30. I mean, it's just creepy, but then you do hear a lot about having the reaction from the cosmetic side, but I didn't know that they would use it for AFib. I mean, that can't even be right.
I know, it's incredibly frustrating. Out in the medical arena, there are people that know that magnesium is helpful for arrhythmias and for AFib. And it's just shocking that they would go to Botox. I guess they would be injecting it in the heart. I mean, where else are they going to inject it? In the area of what they think is scar tissue that creates AFib. That's what they're ablating when they do.
But what's the value of, what's its function that it would be useful there?
It's supposed to relax tension in your wrinkles in your face. Like the main Botox point, I think, is between your eyes, in that the top of your nose, that area that people scrunch up. So Botox injections prevent spasms and wrinkles. But I'm just looking at this up. If it's preventing spasms, then that's what magnesium will treat. Yeah, here, Botox injections noted primarily for the ability to reduce the appearance of some facial wrinkles. They're also used to treat such problems as repetitive neck spasms, excessive sweating, overactive bladder, and lazy eye. So they're using it to relax muscles.
Wow.
So in the heart, if there's a spasm, I mean, they say it's sort of scarring of the heart that can set up the arrhythmia, but spasm means magnesium deficiency. So they're treating all these things with drugs instead of magnesium deficiency treatment. We're not treating a disease, folks. We're treating magnesium. We're not even treating. We're just replacing the magnesium in a magnesium deficient person. Amazing.
It's amazing, and it works.
Okay, so a couple of quick testimonials emailed in. As always, thank you so much. I've received better advice and help from Dr. Dean and the staff than I ever have from doctors over the decades. I'm forever grateful. Age 84-year-old woman says, thank you very much. I get a little confused at times, and this will help me. Thank you, thank you. That's what we're here for. If you get confused, we will unconfuse you. Now, here's a question about magnesium bicarbonate that some of our magnesium fanatics are using so they can get something cheap and not buy Remaing. So someone wrote to us that I guess it's he's consuming about a liter of magnesium bicarbonate a day, which I make, he says, with 4,000 milligrams of magnesium hydroxide and carbon dioxide injected into a quart bottle and shaken and re-injected until all the magnesium hydroxide is converted to magnesium bicarbonate. So he's drinking 4,000 milligrams of magnesium hydroxide a day. That's a lot of magnesium. I don't know if it has a laxative effect, but it's also a lot of magnesium that's not fully absorbed. And I said to him, I've spoken about this on my radio show. I suppose I should blog about it. Drinking any form of bicarbonate will basically neutralize stomach acid, which is already too low to begin with in most people. Bicarbs are a great buffer in the blood when they are formed in the body biochemically, but not when you take them in your mouth and neutralize your stomach acid. Taking bicarb by mouth is not the same as the body making it in a balanced fashion. When you take it by mouth, you're medicating yourself. You're neutralizing stomach acid, and then you make the stomach work extra hard to produce more acid. I repeat, bicarb is not a health supplement, it's a drug. Magnesium bicarb is not a health supplement, it's a drug. So have people been calling in about this? Every once in a while we get a report, but do people talk about this magnesium bicarb, Ginny?
Well, they do on the, on social media where everybody can kind of just get in like a big mosh pit and start throwing all their ideas around without any, medically or biologically accurate balance. So, yeah, they do definitely. They think it's brilliant stuff, and they're always talking about their great invention. But when I do catch them, I'll pop in and say, hey, guys, you might want to rethink that.
Right. Yeah, there's so many people kind of hacking their health, and they really don't know what they're doing because the whole basis of magnesium in the body and testing it and all that, or doctors knowing about it, it's so much in the dark ages that people really don't have a clue. We're the only ones that know what's going on.
Right. And we can't say a lot about all the things that we're doing at the, high end of medicine kind of level, but 2019 will be a very clarifying year, I think, for a lot of people who are piddling around with some of this, Remaing, because honestly, what is 4,000 milligrams of magnesium, whatever it is, in times, 30 days in a month, times all the time and effort, times what are the actual qualities of that and how is it tested and what are the unknown factors that it might have, like fillers and, heavy metals and things like that are coming from the original product versus a single bottle of Remaing for $29.99, which is an absolutely known entity, 18-point quality control, totally tested, and has a known quantity delivered at a cellular level in a measurable dose. I mean, there's just no comparison. And they think they might be smarter. They're saving themselves money, but they're not probably doing either.
Right. We'll get people who'll email us and say, can I use the magnesium that's used in aquariums?
It's so true. It's not funny, but it is kind of funny because it's like this is not necessary. This is why Dr. Dean has gone to the great lengths that she's gone to. She should be retired. She's in Maui, for crying out loud, to make sure that people have the quality, the education, the opportunity. I mean, what you've done, Carolyn, what you've set up is absolutely amazing.
Right. Yeah, it's a free-for-all out there, Ginny. It really is, and everybody's just trying to hang on. And I know, I think I sent you some words of what came to me the other day when I got, as I do every several months, someone said, well, a friend won't use your Remaing because you're a doctor talking about your product. You're selling a product. And somehow that disqualifies me from being an expert. And what I realized was, they just think I'm maybe buying a magnesium and slapping a label on it and hawking it to the public. But what I've had to do in my world is because I needed a non-laxative magnesium for myself, I selfishly made it. I travel to the manufacturer regularly to make sure they're up to scratch, and we do all the FDA testing and the quality assurance and third-party testing, and we make sure our Remag is what it says and is as all the aspects of it are covered. And at the same time, we keep our company privately owned so that we're not like Nestle or Clorox that owns most of the nutrient supplement companies now, and will be subject to their shareholders telling them that they have to buy the cheapest products in the world. And what Codex Alimentarius taught me back in 2004, 2005 is that the World Trade Organization, the World Health Organization are allowing the cheapest products, the cheapest ingredients with as much heavy metals as they can get in there. They are not doing any quality assurance in allowing the various toxic ingredients into food and dietary supplements. So you've got to have somebody in your court, on your team, taking care of all these things, because most people aren't. So that's what I began to realize. That no, I'm not just selling supplements. I'm creating a supplement that is guaranteed not only to be safe, we are pretty much guaranteeing it to be effective as well. And like Junie says, when people get in touch with us and think they're asking us the tough questions like, well, you say it's non-laxative. Well, it's laxative for me. And then we just say, oh, well, how much did you take? Were you taking a whole teaspoon under your tongue at once? And we find out how people just don't read the labels and don't really assess their condition. So anyway, we're just in a position of power, and we're not trying to be an authority over you. We're trying to give you the authority and allow you your own power. But we're right there beside you. We're not trying to lead you or be your doctor in any way. We're just working with you because we're all in this together, and we learn as much from our customer questions as you learned from our answers. It's a totally copacetic world.
Yeah, it's very, very cool. Very cool. Kaylee types in, Dear Dr. Dean, I'm 80, and I've been on a vegan diet for the last 20 years, and I felt really well. However, about 3 months ago, I was getting tired, and because of signs in my nails, I figured out that I was mineral deficient. So 2 months ago, I found your site and I started your products. I am doing very well now, and I have lots of energy, and I was pre-diabetic, and now I'm even better doing with that. I did not want to write it because I know you don't promote vegan. However, I heard you say it's not for everyone, and with this I do agree. It's not for everyone.
Oh, very good, very good. Yes, if you... there's somebody who's observing, and that's what Shannon said. It was after 20 years she started noticing that she wasn't well, and she said the past few years the only thing that kind of saved her was taking our products, but she was still determined to make it work, and it can work for some people. I think though there's also a level and layer of massive stress in some people where they just might need more animal protein. It's very hard to say. There's no generalization to diet.
Absolutely. It's absolutely. Gail typed in from Maryland, Carolyn, and asked, when I first started taking Remag, it seemed to go straight to my sinus area. I would feel some discomfort in that area. I am now up to 2.5 or 3 teaspoons a day, and I still have this issue, but just not as much now. What's up with that, she says. What's up with that?
Well, look at yeast overgrowth, Gail. See if there's something about either the yeast-producing foods, the sugar, wheat, dairy, or sugar, gluten, and dairy. Look at doing Pico Silver, or look at doing the yeast questionnaire and perhaps a yeast detox. But yeah, a good product will identify the area that the body wants to be a priority. And sinuses, they're so well known to be areas of yeast overgrowth. The Mayo Clinic, I said 97% of sinus infections are fungal. So look at all that and let us know what you find out.
Very good. Excellent. Excellent. Okay, so 11 minutes to the end of the show, and what else do we want to cover today, Carolyn?
Get some more mailbag, comment on the homeopathy show we did December 3rd. Thank you for another great radio show last night. Even though I've used homeopathy with some success in the past, now I'm thinking I've been there, done that. I was greatly enriched by actively listening last night. As a patient, I can definitely say that Carolyn is correct when she states that many of us may not receive the best of what modalities like homeopathy and acupuncture can offer because our vital force is suppressed due to mineral deficiencies. This is so important. I can say it's true to my personal experience so far. In the short time I've been using Remag, Remite, Realign, things have changed dramatically in my experience of daily energy production and vital force. I've tried many other healing modalities over the last 10 years, but nothing ever took hold permanently and stayed. I can now say with certainty that I know it was due to my deep and long-term magnesium deficiency. This conviction did not come from just accepting what Dr. Dean has said, but from my understanding of my own symptoms, my own search, and presently my own experience of feeling stronger and stronger every day. All this, and I haven't even started my RNA reset drops, arriving this week. So isn't that awesome? And we just love that. This came from my understanding of my own symptoms, my own search, and my own experience. That's perfect.
Yep.
Someone asked about fibromyalgia getting worse in the winter, and I said, well, in my world, fibromyalgia is 50% magnesium deficiency, 50% yeast overgrowth. In the cold weather, it's more stressful. People shiver more. I don't know that they sweat more, but I think you burn more magnesium in cold climates and in noisy environments, like pilots and flight attendants get magnesium deficiency because of all the noise, the high pressure in an airplane. She asked about glucosamine and chondroitin sulfate for osteoarthritis. I said I'd never really seen them be a cure, but to start with Remag and really saturate yourself before you go to anything else. The blog Lifelong Prescriptions, someone commented on a show we did where I said something about the Nuremberg trials, how doctors would not pass the Nuremberg test because they're just continue to give drugs with so many side effects. And the long-term prescription, someone else talked about how medicine says that only drugs cure people, but that's obviously not the case. And another woman said about lifelong prescriptions, well said, Carolyn, so true. This is a doctor. She said, I rail on about this all the time. I think the other most common prescription is statin, which also does more harm than good. She said, I got diagnosed with osteoporosis in my 50s. Before I knew any better, I took the bisphosphonate that my doctor prescribed. After a year on the medication, I had a repeat bone DEXA test, and it was worse than before. All I can say is thank you, God, because I knew that, I threw that whatever out. She called it a bad name and never looked back. I found a nutrition exercise protocol and reversed my osteoporosis years ago. And it's hard to believe that the majority is still duped by this medical system. Yeah, I don't know what's going to happen. I hear President Trump talking about reducing the cost of prescription drugs, and that's not going to help. It's just going to make drugs cheaper so more people will take them. We need more choices. We need insurance to pay for alternatives. This is a report from a couple of patients that speak with Julie. We are doing so well. I'm currently the husband on 3/4 teaspoon Remag, a 3/4 Remite twice daily, plus Realign twice daily. My wife is up to 1/8 teaspoon of each twice daily. We are excited about the positive results even at this early stage. He says, I'm definitely stronger, more balanced, calmer, more mental clarity than prior to Remag. I still get occasional heart irregularity. Can't wait until Magnesium or Remag resolves the AFib. All the multiple surgeries had left me with significant balance issues. Those are much better, although not completely gone yet. I'm traveling and working again. That is going really well. My wife feels much better, much stronger, much more stamina for the day, better sleep, less issues surrounding her sleep. It's difficult to tell the difference between the gradual lessening of many issues her stroke has left behind or whether those can be attributed to the magnesium and minerals. But it is clear that she's vastly improving, even at 1/8 teaspoon twice daily. Again, we are extremely grateful to Dr. Dean and all the staff and Julie. Enjoy your holiday season. Now that's awesome. Someone with a stroke improving on 1/8 of a teaspoon. Crazy. So, Jenny.
That's amazing.
Yeah.
Nobody ever anticipates improving in any kind of a condition like that. None.
No.
I mean, it's just a sentence for decay, decline, and ultimately, the big boot. I mean, so it is awesome, and which also not only praise to Remag, but what just about praise to the body for being so amazing that it can reinvent itself and it recreates itself and it revives itself every single second.
Yeah, and it's wonderful that there are a lot of couples doing the products together, and they will always have different experiences, and that really reinforces how busy magnesium is in so many different parts of the body. When you have 700 to 800 enzyme systems, and when you have all the various organs that magnesium is required by, and the priorities in the different individuals where it'll go after his balance and her muscles, and it's just fascinating. And actually that's what makes it something that doctors just freeze under the possibility that something can do so much and be so dramatic as well. They just won't even go there. They just have to avoid this stuff like the plague. It scares them so much.
Yeah, absolutely. Okay, so that's the wrap-up for 2018, Carolyn, and What an incredible year. Such an honor to work with you, as always and as usual. I mean, they're just the roster of things that have been accomplished and the amount of lives that have been touched and the way that the products have expanded into different countries, the things that were added to the product line this year, and, of course, the absolutely impeccable and invaluable contribution of your totally wonderful and absolutely amazing husband, Bob. We haven't even begun to laud his contribution and amazing praises for what he's done this year in 2018, the silent witness to all things behind the scenes, always pushing and charging things forward, elevating at all times. I mean, gosh, what an incredible year.
Yes, praise Bob.
Congratulations, Jenny, for working with us.
Yes.
Thank you, Bob. Thank you, Bob.
The right place to come to.
Yeah, the check is in the mail, Jenny. Check is in the mail.
No, it's
and
been
also
really wonderful.
Jenny's getting 25 pounds of macadamia nuts as we speak.
Oh, my God, listen to that. That'll sustain me on my keto diet for at least 3 months. No, I'm just kidding.
Yeah.
No, that's wonderful. That's wonderful.
And, we have to thank Bill as well. Bill's just always there for us, and we really appreciate him. Although we're going to have to change the lead-in music to the show. We'll get on to that in the new year.
Yes, we'll be fixing that. We've got 2 weeks to get it done. And all of our faithful listeners, like our good friend Leon and everybody, I mean, so many people who listen in and type in and are constantly contributing, and we're just so grateful. And, of course, our amazing customer service team, including Melody Rose, who types her little fingers out every single week to get these show transcripts to everybody. There's just no end to the powerful contribution people make around us, Carolyn.
Yeah, no, we're very blessed, and we appreciate everybody. So everybody just sit back now, grab your Remite water, and slurp it down.
That's right, and enjoy your happy, Merry Christmas, Happy New Year, and we'll be back next year, everybody. Thank you so much.
Thank you, Jenny.
Thank you, Jenny. Thank you, Bob. Thank you, Bill.
You've been listening to Live with Dr. Carolyn Dean here on AchieveRadio.com. Till next time, so long, and thanks for all the fish.
AchieveRadio.com.
Psychic radio, holistic radio, spiritual radio. This is AchieveRadio.com. Follow us on Twitter at twitter.com/AchieveRadio.
When you purchase the latest TV, tablet, or smartphone, don't forget to do the right thing with your old ones. Recycle them. The Consumer Electronics Association and its members are making recycling your